Conversations on Healthcare welcomes the brightest minds in health policy and innovation. This week, hosts Mark Masselli and Margaret Flinter welcome Education Secretary Miguel Cardona on the impact of COVID-19. Now here's Mark Masselli and Margaret Flinter.
This is Conversations on Healthcare. Our guest is U.S. Education Secretary Miguel Cardona, who holds the nation's top education job as America's schools tackle the COVID health challenge and the learning losses it's created.
Secretary Miguel Cardona first gained national attention while serving as Connecticut Education Commissioner, where he navigated the safe return of students to classrooms in his state. Secretary Cardona has been a teacher and a principal, fulfilling President Biden's promise to put an educator in the nation's top education job.
Mr. Secretary, thank you so much for joining us today.
Hey, great to be with you both, Mark and Margaret. I'm glad to be on the show and honored to be able to engage in a conversation about a topic I love so much.
Oh, that's
our
great.
Kids and our schools.
Absolutely. 7 school boards are challenging Virginia Republican Governor Glenn Youngkin's executive order banning mask mandates in schools. And the school boards say masks are needed to ensure the safety and welfare of all students. What's your take on the situation? And is there anything that your department can do?
Yeah. Well, my message from day one has been very clear. And by day one, I mean March 2020, before I was Secretary of Education, when I was Commissioner of Education. And it stems from my feelings as a father. There's nothing more valuable to me than my own children and their safety and their health, right? So one thing we did early on, and part of the reason why Connecticut was successful in safely reopening schools, is we relied very closely on our health experts. It is a health pandemic. We need to keep it in the hands of our health experts. I had more conversations with epidemiologists than with my own family members for so many of those months. And the reason why we did that is because they have an understanding of how disease spreads and how to keep ourselves safe, right? That hasn't changed. I think what has changed is the fatigue across the country. We're 2 years in. I remember planning for 2 weeks of disrupted learning. We're in our second year. So the fatigue has increased. I also think politicization of many of the strategies to keep our families and our schools safe. It's become political in so many places, and I think intentionally, and that's unfortunate. So, the leaders and the educators today have much more to contend with. They have not only the pandemic, but also a growing fatigue and politics getting in the way of good public health policy. So what we've done, it happened when the Delta spike happened, if you recall. That happened maybe 2 weeks before school started in the fall. We really were very strong at the Federal Department of Education, communicating that it is the responsibility of our superintendents and our boards to protect our students and our staff. A safe working environment, a safe learning environment is critical. And we still believe that. And we have worked closely with all states to make sure that message is there. We supported our superintendents that are making decisions to protect students and staff. And we'll continue to do that. I think really everyone wants our kids in schools. We all know the benefits of in-person learning. We have to leave public health to the experts. But I also understand we're all fatigued. We all want a day when masks are not required. But right now we know, especially with Omicron, we have to do everything in our power to keep our children safe. And that's following those mitigation strategies that the CDC recommends.
Well, Secretary, thank you for those comments. And masking has been polarizing. Mandatory masking in the schools has been a polarizing issue. But now the Los Angeles and the Washington, D.C. school districts are putting in place COVID vaccine mandates for students. I think they're set to begin soon. I imagine this will also create quite a bit of controversy. What are your thoughts about keeping students out of school if they're not vaccinated?
I talked to the mayor of New Orleans maybe 3-4 weeks ago. I was visiting New Orleans schools, and we had a conversation about that. She too was implementing a requirement for vaccinations for students in the schools. And I recognize that vaccines are the most important tool we have. It really is, to prevent disease spread and to prevent severity, to keep children out of hospitals, to keep communities safe, not just for the student that's vaccinated, but for their vulnerable family members or those in our community who are unable to get vaccines, even if they wanted to. With regard to the requirements, those are local and state decisions. I think state leaders and local leaders need to understand the implications of that. I strongly encourage not only vaccines, but also that our schools have a role in promoting vaccination. We've set up clinics throughout our country. I visited many with Dr. Murthy and others just to promote the importance of schools having a role here, pediatricians having a role partnering with schools. As far as the mandates are concerned or the laws, I'll leave that up to the local officials. But I do know that in places where vaccination percentages are higher, there's less disruption to school and there was less hospitalization, which is obviously the goal for any parent, to protect your child.
And protect your child is so important. And Mr. Secretary, you know that our organization here in Connecticut operates school-based health centers across the state, providing care to 17,000 students, including their mental health needs. But in the entire country, only a fraction of students receive that type of service. But there's good news, I hope, or hope's on the way. The bipartisan Hallways to Healthcare Act has been introduced in the Senate. It would lead to greater investment in school-based health centers. I'm wondering, is there anything else the administration can do to push this idea?
Sure. Yeah, I know a little bit about what you do in my previous roles, and having people that I know very well working within a community health center. The reality is, the days of us thinking that our schools are places where it's only about reading, writing, and arithmetic, those are long gone. We need to think holistically about our children. I was fortunate to serve in the Meriden Public Schools for over 23 years, and I saw as the needs progressed with our students, we needed to evolve in our thinking. And the partnership with the Community Health Center to provide support services, mental and behavioral support services to students, dental services, just the health needs of our students, they're present in our schools. So the more we can remove barriers by providing good partnerships with community organizations like Community Health Center that provide some of these services, the better the students are able to learn, and we can focus on teaching and learning. So I am encouraged by the growing sentiment, bipartisan sentiment, that we must care for the holistic needs of our students. And at the Department of Education, we haven't been sitting idle waiting for this to happen. Day one, we made it very clear that as we are thinking about how to utilize the $130 billion that the President and Congress passed for the American Rescue Plan, safe school reopening obviously is the priority. So ensuring you have PPEs, ensuring you have all the tools you need to safely reopen. But the second thing on our list, and on purpose, was the social emotional well-being of our students and our staff. Oftentimes we leave that out. Our students, their families, and our educators, our dedicated educators, we've all experienced trauma. So ensuring that as we reopen our schools, we reimagine the role of social and emotional well-being, access to mental health supports. So we've really prioritized it. We released a first of its kind support manual for districts in their language, not in government speak, not in bureaucratic language, in their language, on how to implement mental health supports, how to learn from colleagues across the country. And in each of our reopening guidance documents, we emphasize the importance of mental health and social and emotional well-being. So for me, it's critically important that as we reopen and reimagine schools, we don't go back to what it looked like before, where it was insufficient. We must design and embed within our reopening strategies social and emotional supports for students and access to mental health support. So we've encouraged use of ARP funds for that. We've provided guidance. We lifted best practices, and we're going to continue to push so that the ARP money is being used for those reasons, for those purposes.
Great.
Well, Secretary, thank you for those comments. And we certainly have seen an evolution in many ways over these last 15 or 20 years, as you say. One of the changes that we saw this year, over the last 2 years really, was the level of engagement of parents, and often very unhappy parents, around some of these issues in the schools, around masking and around the response. to COVID, and it kind of raised the question of who do the public schools really belong to? And there's been some debate popping up that we need to do better at listening to parents, though I know you've always tried, and that parents are really the clients of public schools. Is that the right worldview to have, that the parents are the clients and that's who the school systems really have to organize around? Or what have been your thoughts as you watch this unfold over the last 2 years?
I've seen President Biden articulate it very clearly. Not only did he start as president during a pandemic, but during a time where our country was divided. And he aimed to restore the soul of our country and bring folks together. I mean, the work to get to the bipartisan infrastructure plan demonstrates the commitment of working with different perspectives. And we still have ways to go. There are a lot of folks that are divided on certain topics, whether it's masks, mandates, or whatever. It's really important that we recognize that schools unite. Schools are hubs of the community that bring people together. And it's really important as we reopen schools and really think about the next chapter of what education looks like across the country, that we're not limited by listening only to those who share our thoughts, that we entertain the various perspectives that exist and understand that there's a lot of emotion behind it. There's a lot of passion behind it, but it's the American thing to do, to listen to different perspectives and come together, especially around our students, around our children, to improve education. So I think it is important that all families have access to be heard and that the different perspectives are taken into account. At the end of the day, it's critically important also that we have boards of education that represent families. In many cases, especially in the experiences that I've had, board members are elected and they represent the different parts of the community. So we must recognize that democracy prevails and that we have a system set up where we should be listening to parents. But I also would argue we need to be listening to our students and make sure that their voice is being taken into account as we think about how to reimagine education. Our students have experienced this firsthand, and they also have say in what education should look like moving forward.
Well, that's such a good observation. That American solution is really going to require listening to voices across the spectrum, including that of teachers. But you bring an interesting perspective to Washington, and I wonder if you might reflect a little on it. You were a teacher, a principal, and you're also your experience as an English language learner. How have all those helped shape your thinking as you lead this really very important department in an important time in American history?
It's a time that requires the ability to problem solve with those whose perspectives are different, to engage with people with whom you don't typically engage. As I mentioned, I became good friends with epidemiologists over the last 2 years, something that I never learned in preparatory school for education. But I'll give credit to Meriden, Connecticut, the city where I was born and raised, where I went to school. It's such a diverse community. And as a second language learner, I learned English second, and living in a community that's so diverse, and myself being bicultural, I understood how to code switch and culture switch and understand different ways of doing things. That helped me during the pandemic understand the different perspectives and keep that mentality that just because someone doesn't think like you doesn't mean that they shouldn't be heard or that they don't bring value to the table. And I think that's what the president was looking for, someone that can go into the moment and recognize that there is no easy linear solution to this, but is willing to engage different folks, listen, and come up with a solution that is best for students, number one, and that can lead our country forward. So the biculturalism, I always say, is a superpower and an asset for me, coming from a very diverse community, and then being educated and having the opportunity, the privilege to serve as an educator in a community as diverse as ours, in my opinion, were really good prerequisites to the problem solving and the what I call intentional collaboration that I do today as Secretary of Education.
Well, it's great to have educators like yourself in top places in Washington right now. And we also have another person in pretty high places who comes from education, and that's First Lady Dr. Jill Biden, who's still teaching at a community college today, even as First Lady. Are you getting any feedback or advice from Dr. Biden on what we should be doing in education, what you should be doing?
You know, she's great. Who better than her to really, show what education can be and just be such a great advocate for the education system. I always say my job is easier because the best advisor to the president is an educator. And, I had the privilege of traveling with the First Lady last week. We visited a school, a community college, to announce, not only to see the great work they're doing, but also to announce $198 million in grants to help support basic needs of students so that they can go to school. Needs like childcare, needs like food insecurities. So we were announcing this, and in my conversations with her, it's very clear. We need to make sure that we're providing opportunities for all students to go to school, to study, to reach their potential. And I know she's still teaching, and I know her passion for education across the country stems from the inspiration she gets from her students. So it's always great to have conversations with her to talk about education and our path forward in our country.
Well, Mr. Secretary, we want to thank you for joining us and hope we'll have you at some time in the future. And thanks to our audience for joining us for this important talk. You can learn more about Conversations on Healthcare and sign up on our email at chcradio.com. Mr. Secretary, thank you for your leadership, your inspiration, and the work that you do on behalf of all American citizens.
Thank you, President Masselli, Vice President Flinter, for your for the conversation, but more importantly, for the work you do to promote health across our community, across our state, and across our country. Be well.